Just wait as people connect here. Awesome. Welcome, everybody. Can everybody hear me okay? Okay, perfect. Well, welcome to the sixth and last of the webinars. We're kind of bummed. We were just kind of talking before we let you all in what fun we've had doing this. Really getting, a pleasure to meet you all and interact with you all and answer your questions. So tonight we really kind of reserved it to be question and answer, last minute kind of issues and things. But we thought we'd start off with just offering some kind of free tips and tricks from our perspective, because we're on the other side of the desk or on the other side of the computer this year. And so, we'll just start with just some tips and tricks. And then, as usual, submit your questions by the chat box, or at the end, you can feel free to kind of voice your questions. So I'll go ahead and start. We have several associate program directors on tonight. We have a couple of the residents as well. So, any kind of questions from your guys' standpoint are fair game. So just my sense of this interview time. Number one, this is a very uncertain process for both sides. I know you all have never gone through the process. Maybe some have and are reapplying, in which case it will be different. But for probably the majority of you, you don't know any different. And this will be the first time you're applying to residency and you're doing it virtually. So, with that, I want to just kind of offer for you that the anxiety that everyone is feeling with the virtual format, I can tell you it's felt on both sides. We were just chatting before we let you all in. Again, one of the great things about this place is having an event coming, seeing the place, et cetera, and we really don't get to showcase that for you. But that puts the onus on us to really showcase it in different ways. A day in the life, we may follow someone around virtually. We will have videos to show, et cetera, et cetera. So I just wanted to normalize the anxiety. So if all of you are feeling anxious or uncertain as to what to expect, that's normal, because we're feeling it too. But we have many innovative things to try to do our best to sell ourselves. Number two, for this process, for any process, whether it's now or jobs or fellowship, whatever, be yourself, okay? Don't write a personal statement or don't say things in an interview that you think others want to hear, okay? Now, I'm not saying go off the fringe and be completely political and go on a discourse about something, but don't feel bad to talk about something. If you're asked in an interview, okay, well, where do you see yourself in 5 to 10 years? Do you want to do academics, private practice? If truly you want to do private practice and you want to be in the community, then tell them that. Don't feel that every program needs to hear you say, I want to do academics, I want to teach, I want to, because, we've interviewed many, many people, and we can tell when something's sincere, something's not sincere. So be yourself. If you want to do private practice and be in the community and or something, then tell them, be totally honest. And if you feel a program is judging you because of something on your application, whether it's a certain score, or maybe you don't have as much research as you think you may have wanted, et cetera, and you feel a weird vibe pointing that out, then quite honestly, I wouldn't want to train at that. They don't have the value that you want. Number three, in like chart reviews or things like that. What I mean, research yourself. And so what I mean by that is know your application up and down. They will ask you about, if you've done something, like if you've done missionary work or you did Habitat for Humanity or something, to talk about those things. So research yourself, know your CV up and down. Nothing is worse than them asking a question about something or something you did and, oh gosh, I hadn't thought about that in years. It could be something, 6, 8, 10 years ago. So know your applicant up and down, but be able not only to be able to talk about what you did, but take it a step further and think about what you learned from it Think about what it taught you. Think about how you grew from that experience. So they say, oh, tell me about, again, I'll use Habitat for Humanity or something. Tell me about that. Okay, well, I help people build houses. Well, if that's your answer, then that's not very insightful. You talk about, the altruism part of it. I grew as a person. It, made me reflect on that others, no matter how bad I think I have it, others have it worse, et cetera. So take it one step further and not just know your CV about what you've done, but get in touch with how things you've done made you feel. So research yourself. Research the institution you're interviewing at. Okay, so what do I mean by that? Know about the program. Read about their website. Read about the staff and the residents who are interviewing you. Have a working knowledge of them. Saying that be a sucker and somehow work into an interview about some remote paper that they did sometime. Oh, it reminds me of that you wrote in 2001. Then they'll think that's kind of so. Knowledge of what they do, because it helps you anticipate maybe some things that they'll talk about. Like if you see that, if you interview with Dr. Bannon at our institution in ethics, he's starting to think about maybe get scenarios of some potential situations, patient situations. So it just helps you anticipate, the staff, and you'll always have a little about you. So you should read. Think of some canned questions invariably at the every interview. So what questions do you have for me? Sometimes, quite honestly, a little bit of interview. Sometimes I stuff like that. So I'll sit down and they're like, the applicants all getting prepared to talk about everything they've done. And I say, well, what do you want to know about the program? That's be prepared to ask. I can guarantee is, do your residents get their numbers and do they get to operate? Okay. The answer to those are, of course, yes, or else they would not be in it. You can talk about the breadth of pathology and you can kind of go into things, but do not ask, well, do your residents get to operate? Okay. You can say, what's the experience like as a first year resident? Is mainly forward work? Are you in the OR, et cetera? But things I like to ask, or I like when people ask me, or is something like, if you could change one thing about this program, what would it be? Or what don't you like about this program? Or something like, what was the toughest situation you had to deal with in terms of a trainee? Something that, shows that you put a little bit of thought into it. Okay, so that research about yourself, about the institution, about the staff. Number 4, be prepared. And that kind of gets into the research part of things. Now, what I also mean by be prepared, and the person I'll call on next, Dr. Rivera, will talk to you about some Zoom etiquette. Point, just don't focus on it being so different, because you will be more anxious. So just treat it as if this is the way it's always been done, and you're going to go through the process. And like I said, for a lot of you, this is the only way you've known how to apply to residency. So it is kind of the only way. But with that, that's some of my take on this interview season coming up. But I'll turn it over to Mariela Rivera and take it from here.
Excellent. Hello, everyone, and thank you again for joining us. So, talking about tips and tricks about interview, we have to think different this time because we are kind of in this virtual weird world. And there's some things that we've already learned from using Zoom or a virtual platform that is kind of different when interviewing or when we are interacting in person. The first thing you to think of is, a quiet space, find a microphone, find a camera. Is very obvious when things fail. Check it out, practice first. Practice, practice, practice. Once you have that done, then I would recommend that you actually record yourself doing an interview with a colleague, with a friend, with a mentor. And see and play how you present yourself. And ask who I am presenting. Is this the best of me? Right? We don't know you, but we need to get to know you in a very short period of time. Optimize the interactions. And how do you do that using Zoom? Or first of all, if you're interviewing me and I put my camera like that, don't look that hot, right? That's a little bit, right? I want to see your face. The way to do eye contact with Zoom is actually looking at the camera. We look at the monitor because we want to look at the interviewers, but that you're not making any eye contact. So if you want to pause for now and then and do eye contact, go ahead and look at the camera and smile, right? Again, record yourself and take a look at those little things. The background tells a story about you, and you decide what story you want to tell us. Right now, if you were to interview me, I would probably get rid of that thing that is in the back and we'll put things a little bit more organized here. Maybe show my picture there that I like, that is kind of talks about me and my culture. So think about those are little things, but we are getting in a very short period of time the best of you, who you are. So I would say that the virtual platforms give us an opportunity to meet you in a different way. So think about how Zoom or again the video camera on the video platforms, how can you maximize that experience? Okay, be professional, like be yourself, but we are looking for professionals. We are looking to hire the best professionals because that's who we want to train and that's who we want to work with. So that will be my tips and tricks about Zoom, and I wish you guys the best of luck.
Awesome. Thanks, Mariela. All right. Is Travis still on? I think he.
There I am. Yeah.
Oh, okay. Oh, there you are. Okay. Thanks, Travis. What do you got for the potential applicants here? Any tips or tricks, things that have worked for you, things that you've seen good or bad or the ugly through the years interviewing?
Yeah, really. I just want to give you one piece of advice that I wish someone would have given me during the time that I was coming through. And that is, you're not as powerless as you may feel in this whole process. Because I distinctly remember when I was going through interviews and going to the various programs, I was on one side of the table and that I had no the whim of the program wherever they kind of wanted me to go. But I'll tell you that it couldn't be further from the truth. It's really a two-way street. Just like you want to get into the best program you can, wherever that may be, we want to get the best applicants. We want you guys to come here and be interested in this. So the power is on both sides of things. And I think one thing that's very important, especially this year, is you're not going to be able to feel out the programs as well as you would have otherwise if you're there and you're actually getting a feeling and a gestalt of the place, and you're looking at body language of people and are the residents happy. Is ask the questions that you're really interested in. Dr. Stulak mentioned come prepared with some questions. Absolutely. Think ahead and think about the questions that are really vitally important to you. And you need to get those questions answered for yourself, because if you don't, you may make the wrong choice. And again, don't feel shy about that. If there's something that's important to you, whatever that may be, ask that question. And this is your one shot to really get to know us during this interview and get to know our program. And again, it's hard to do this year. But you guys do have power in this. Don't feel powerless. You're going to rank us just like we're going to rank you. And we want you to want us.
That's perfect. Thank you, Travis. Yeah, I couldn't echo that enough. I tell applicants that and they think I'm crazy. I said, you need to feel like you're interviewing the program as much as the program is interviewing you, because we know what your applications look like. We know that your accomplishments, and we know that the match is one of those most unbelievably random, uncertain processes. You know, you just think you have it figured out, and it's not, and it's a little barbaric in some ways. But having said that, you know, we're each on that side of things. So I see Dr. Quay there. Dr. Quay, could you impart some wisdom
Sure.
on this, please?
I I think my biggest piece of advice would be to stay in the moment. Don't get distracted during the interview and be looking off the screen, and then answer your questions sincerely. I think sincerity goes a long way during an interview. So those would be the two
Yeah,
things that
I think
ask you.
sincerely, I want to echo Dr. Quay's point, and that it gets back to be yourself and answer honestly. The people you're interviewing with, whether here or elsewhere, and we're giving you advice, we realize we're giving you advice also to broadcast yourself to other programs, which is good. We want you all to do well, whether it's here or elsewhere. But, you know, just be yourself and answer honestly, because they will, you know, if they hear something that doesn't make sense to them, and they could maybe get a sense that you're not really believing what you're saying, then they may press you on some things, and then it goes south from there. So always stay true to your values, and don't feel bad about it. And like I said, if someone's going to judge you because of something you answer honestly, then you don't want to train there. That's my, you know, that's my advice. I saw Dr. Nelson
I'm over
somewhere.
here.
Oh, there you are. Can you? Okay, what do you
Hi guys,
you
you're
got?
gonna hear some of the same themes. So what I wrote down kind of before talking with you is be yourself. So that should sound familiar. And as Dr. McKenzie said, don't forget your value. I think especially when you're really nervous for something, if you can take a step back, and this is good for all types of negotiation, but think about what you're bringing to the table, because you are all highly accomplished individuals. You're very interesting. You've done lots of things to get here, and you're really interviewing us as much. And I know you've heard this, but you're interviewing us as much as we're interviewing you. But you really are, because you're going to be here 5-7 years. This is a place that's going to mold you through some of the biggest years of your life. You know, you might meet your spouse, you might have children. You know, these are big life events. Is this a place that you could see yourself? And are the people, and this is hard to tell over Zoom, but do these seem like people that you want to be like down the road? You know, do they seem happy? Do they seem haggard? You know, do they still have some joie de vivre? You know, these are going to be your mentors. And I think we've all heard the saying, you become kind of the average of the 5 people you spend the most time with. And so are these people that you want to be like? I think that's really important. And then taking kind of one step further, what Dr. Stulek said about knowing your resume, don't only know your resume, but think about what you want to get across as you talk about these things. So what do those experiences show about you that might be an opportunity to be able to kind of showcase that when they do ask you about that Habitat for Humanity? What does that show? Like, what part of your character can you show through that, kind of discussing that? And then just a few little Zoom tips, like Dr. Rivera, sit up straight, lean forward. You're gonna have to smile, and maybe we can't see your arms. So if you do want to gesture, you gotta sit up a little higher. And then we see some trouble sometimes with backlighting. So if your windows are behind you, make sure you draw your shades or something like that so we can really see your face. And then I just have a little sample, I'm not using it, but there's lots of little cameras. This is like $10. Or there are lights that you can use if you don't have kind of some lighting around your computer, so that we can really see your facial expressions and kind of get to know you that way. But you guys are all going to do great.
That's awesome. So this is good because it's sparking some other things that maybe some of us want to say as well. The first thing that's something that Dr. Nelson just said just spurred me off is when you're asked a question, don't feel you need to jump right in. Okay, take a breath, think about it, and then answer. Okay, they say that Steve Jobs, he had this, it was he was asked a question, and it was always like a 10-second pause. And people would just sit there in the beginning and say, what the heck is he doing? But he was processing, he was formulating his answer so that when he spoke, it was perfectly articulate it got across the message they wanted. So don't feel that, don't think that answering immediately exudes confidence, because a lot of times it's not rehearsed. Sometimes just taking a deep breath slows the heart a minute, just takes a deep breath and kind of gets you into it. And then there was I think it was a Harvard Business Review article I read was, I think it was, do you talk too much or something like that it was named. So when you start talking, and this could be anywhere, if you're a med student on rounds, if you're presenting something, or if it's in an interview, have in your mind an internal clock, okay? And so when you first start talking, the first 20 seconds is a green light, okay? And then after 20 seconds, you start talking, you're talking and talking. And then all of a sudden, you know, the internal clock should start to tell you after 20 seconds, it turns yellow. Okay. That, okay, I've been talking for 20 straight seconds here. And then as you approach 30 seconds, it should turn red. And Dr. Rivera said that this particularly, I don't know, she related to it in some ways, but anyway, have an internal clock, because I can tell you, the more the interviewer talks and the less you talk, I know it sounds funny, the better the impression they will have after the interview. I swear. And you get someone talking about, let's just say that you have some research that they also did, and then they start talking, and great. That's great. It's less time that, this is going to sound terrible, but if I were going through an interview, I think the same thing. The less I talk and the more they talk, the better, because it's less of a chance that I can say something dumb or kind of say something that doesn't look good to them, etc. So whether it's a board exam or whatever, the less you talk and the more they talk. So don't, think about your answers, prepare, because there's certain ones they're going to ask, so that when they ask you, you can have a clear, concise answer and not answer something for 2.5 minutes. That will turn off an interviewer almost immediately. If the first thing that they ask you and then you give a 2.5 minute answer, they'll be deflated a little bit. So I see Brielle here, one of our admin chiefs, outstanding resident, and applying for colorectal. And maybe you can impart, you're kind of going through the process of your own trials and tribulations, what's worked, what's not worked, or what can you
so actually just submitted my rank list tonight. So interviews are done, and they were all virtual as well. So I would say the first two probably take time getting used to, just because you're kind of getting in the process of what background should I use, where should I put the camera, things like that. But I would say by the third one, you're pretty well versed in how Zoom goes. Actually, a lot of the programs that I interviewed at had more difficulties with Zoom than I did, which was quite characteristic, I guess. But I think just be yourself. Once you get the interview, really the program's interested in you, and it's really just about if you're a good fit for the program, if they're a good fit for you at that point. So try not to be nervous, maintain eye contact, like Dr. Rivera said, and just be yourself are the main things.
What was the hardest question you got, or what was one that stuck out? That's actually a question I ask when they sit down. You say, "Oh, where are you in the process?" They'll say, "Oh, toward the end." And in my mind, that's good. And say, "Tell me one of the hardest questions that you got, or tell me one of the questions that made you think the most." And
I think there were that I can think about. One was, which animal would you be? And they actually told me the reasoning behind why they asked that. It's not exactly which animal you pick, but it's your reasoning why you picked that certain animal, because they said they would get some weird ones or some really interesting reasonings behind why someone picked that animal, and it told a lot about the person. But that was one I kind of had to think about for a second. And then the other one was, tell me something about yourself that isn't displayed on your application. And that was one I really had to think about, just because when I was doing my application, I pretty much put everything on there that I could think of that would, make me look favorable to the program. And so that was a hard one that I had to think about for a second.
Yeah, I'll tell you, Brielle, that last one is actually quite a classic one that I like to ask or whatever, because some things don't come through, on a CV. And so that ties into, this is your time to tell them who you are, because we know the numbers, we know the research projects, we know all that stuff. But, the minute that stuff's important, quite honestly, to get the interview. The interview is about then the character, it's about the person. To me, I by the time you get the interview, I mean, step one goes away, research goes away, the CV kind of goes away a little bit, but you've already passed the stage where you've gotten an interview. And so at that point, it's about you. Why are you going to be the best resident that this place ever had? So that's, that's another way to look at it. Let's see, I see Sarah's on, has attended, I think, all 6 at this point. So thank you, Sarah. PGY 3, clinical year 2, so in her research year, and has been instrumental in putting on both of the resident sessions as well. To her, we're very indebted, and a mentee of Dr. Rivera. So of course she's awesome. So Sarah, maybe share some of the things. I know you probably, you had to interview for the CI, you had to do some interviews here and there. So, maybe some words of wisdom, please.
I guess maybe 2 comments, 1 or 2 suggestions. One is you will get questions that you are not prepared for. I know that happened to me in my CI interview. They asked me, what is the title of the final talk you're going to be giving 15 years from now at a major conference? You are the main speaker. What's the title of that talk? And that's a question I'd never found that in my searching. It's not a question I'd ever been asked. And I came away from that interview thinking I bombed the interview because I had never heard that question before. And I just said the first thing that came to mind. And I think being prepared to know that you will get those questions, taking a moment to just breathe, and then settling yourself within your values and using your values to answer that question. And that's what I kind of ended up doing. So I'm really interested in gender bias in surgery. And so that's what I focused on in my answer to that question, even though I had never thought of a question like that before. So if you can balance yourself and kind of center yourself around your values, then you can handle any question they throw at you because you can use those values to come up with an answer. And then the second thing is, don't be afraid to ask questions about what your life is going to be like. So I think there were a lot of, Dr. McKenzie, Dr. Stulak, and Dr. Nelson all made really good points about asking appropriate questions and asking questions of the program. One of the questions I always asked was, what's the bass fishing like in this area? Because my husband is a bass fisherman. That's one of the things he loves to do in his spare time. And I knew that he wasn't going to want to move to a place where he wasn't going to be able to find good fishing within about 30 minutes to an hour of the city. That was a question that would start a conversation with my interviewer about what there is to do around town, what their interests are, and what my and my family's interests are, to help see if this would be a good fit in terms of program and location for me. So don't be scared to ask those types of questions. Interviewers, it seems, want to know who you are as a person too, not just what you're going to be doing on your work hours. So.
That's great. You want to stump an interviewer? There you go. Ask them what the bass fishing's like around their program. So, okay, that's awesome. Thank you, Sarah. Yeah, Sarah makes a good point, and it's kind of symbolic of what the field of surgery is like. You don't know, you may think you know what an operation is going to be, and we try to turn every operation into as routine of an experience as we can. But as the staff surgeons know here, not every operation goes from point A to B to C. You need to be able to improvise. Routine operation, just improvise, preparation and training and practice, deliberate training, all that. So you want to turn as many of these instances into as routine as possible. So that's where the practice comes in. That's where anticipation comes in. In surgery, an ounce of prevention is worth more than a pound of cure. If you can anticipate problems, the minute you're trying to rescue a patient from a complication or a problem, you're already behind the 8 ball. So the interview is the same thing. Try to anticipate as much as you can, but realize going in, and don't freak out while you're in the interview, that you're likely going to get questions that you didn't prepare for and you have no idea what the answer is. At that point, like Sarah said, stay true to your values, or Brielle, I think, said, stay true to your values. What other, do we have some other trainees?
We have some questions starting, so.
Oh, okay, let's do that. So it's been 7:30. It's been a half hour of tips and tricks. That's good. If something else comes up, please, answer, or please ask. But okay, we can start with some questions.
Okay, Can IMGs choose to go on the rural track for training?
Okay, well, we just graduated our first rural track last year, so I'll say it's still we're still early in the experience. I will say that an IMG applying to the program most likely will be interviewed on the prelim track. However, I will say it's happened each of the last several years that we have then, found an unbelievable IMG with credentials and we match them for categorical. So if that were the case, if it was kind of an outstanding applicant, I would never say never. I guess I would put it that way. We have matched IMGs into our categorical track, and if that were the case, then they could have a rural track experience. The rural track has been so well received by the trainees that have gone through it, and we rotate through so many great health system locations, and I'll ask Dr. Nelson to comment some on that, as she's the director of the health system practice and surgical practice. And so from my standpoint, we may even be looking to expand that. So I guess long-winded answer to say that I would never say never. I would be honest and say that the international typically come through the prelim side of things. But like I said, if someone comes along and absolutely wows us, we've matched IMGs directly into categorical. So that's not unheard of. Megan, do you want to comment a little maybe about the rural experience or some things that I know we're just starting a formal rotation at your two sites in Austin?
Yeah, so the rural track I think is kind of a really special program. The Mayo Clinic Health System spans across Minnesota and Western Wisconsin, and it's a whole variety of different hospitals. There's critical access to like level 2 trauma centers, and that's all considered within the health system. So quite a bit of variety, a lot of bread and butter general surgery. We have some surgeons like Clare, Wisconsin, that are general surgeons. They also do aorta work. They do thoracic work in some areas. There's it's kind of true general surgery and a pretty broad spectrum in a lot of the spots. So we would love to have you rotate through that. And I think you'll find it's a lot of passionate surgeons, a lot of surgeons that, or we have some that train through Mayo and have gone out in the community. And that's something we hope for a lot of our rural track physicians. We'd love to keep them in the community nearby. So we would love to have you. It's a really good experience. You get lots of endoscopy experience and then just good bread and butter general surgery.
Oh, that's great. Thank you. Go ahead, Angie.
Could you please suggest how long an intercession may last, given that it's now held through Zoom?
Well, Mariella, Teresa, what's our scheduling looking like? I mean, we used to do half hours with a couple staff. We used to do group interviews. I'll be completely honest with you that our process is not completely decided upon or mature. It's going to be amazing no matter what we decide for it to be. It could be 3 staff and one applicant. We do surveys after we get feedback, and some of the feedback was that they wanted more access to the staff. So then we had with 3 staff each, and so just to increase the access and so that more people could speak on your behalf. And so I would say 20 to 30 minutes. Teresa, what do you think?
So I'm still envisioning that we are going to keep it similar to the last several years, where you'll probably end up with 2 interviews. And during that interview, there might be two staff and a resident, or it'll be a team of interviewers. We just have to fine tune those details.
Yeah, that's what I said. It's not, just as we talked about in the simulation portion of things, there will be task related items, just like we did in prior years. So that's what we would envision, kind of 20, 30 minutes, something like that. We may find as we schedule it and maybe go through some dry runs that the electronic thing seamless, and maybe we can add different things. Maybe you all will have an interview with me personally. Maybe we can work that through. There's really, I do think that we'll try to keep it, like I said, try to keep it as normal as possible, but we may find that without shuttling people from one to the next, where you can click end on one and click next on the other, or have different rooms, that we may be able to accommodate more access to the staff.
Okay. Should I send 3 or 4 LORs to this program? In your opinion, would it help or hurt to send 4 letters? Or do you prefer 3?
Well, I think that the number is not as important as the quality. I tell people all the time. So here, we can talk about letters for a minute, tricks and tips. So quality over quantity and quality over names. Don't feel you need to get the chair of the department if they don't know you and they will write a generic letter with a paragraph that's this long. That's not helpful for us. And quite honestly, I look at what is written. I don't look at who it's from. So if your best letter comes from your internal medicine rotation and they can tell me how much you walk on water, I'd rather have that letter than a surgeon who you spent 1 week with and maybe scrubbed once with, who can't tell us anything. You have to think about what, but now that's just for this program. Please think about this, is that some people may be into the names and may be into the dean's thing and maybe into all that. But I can just tell you personally, I think reading letters, and I think letters are going to become more important this year than other years in that, because it's all virtual and we're going to have to rely on a lot of, there may be some programs that say you need all surgeon letters. I'm not one of those program directors. I would love to hear from your clerkships and tell me what an amazing resident you're going to be. I don't, it's, the surgical clerkship as a medical student can be very limited in some places. Like it was 6 weeks. We just got it lengthened to 8 weeks. Travis McKenzie's now the surgical clerkship director after I was it. And during that time, you spend some anesthesia time, some ICU time. There's a 2-week rotation there. In some programs, you need to realize that sometimes a surgical rotation may only be 2 weeks with a certain surgeon. So, we recognize that. So to me, I think a good rule of thumb is quality over a name and quality over quantity. So if you have 3 walk on water letters and that's the minimum that someone requires, then I think that's fine. I wouldn't say, oh, they didn't upload a 4th letter, something must be wrong. So I don't know. Does someone else want to? Teresa looks like she's burning to say something.
Yeah, I would submit what the program requests.
Yeah.
If a program requests, I wouldn't submit 4.
Yeah. Good, very good. Different programs require different things. So some require dean's letters. And, so I get it. There at one point, and you need to have the dean's letter, you need to have some chair of something with some name who likes to put 17 titles under their name and things. And I just, we grade the content of the letters. We don't make a note that it wasn't from a surgeon necessarily. So we want to find out who you are. So personal statement, letters, those are what's helpful, the CV.
They're on the side of people who know you really well and who can speak on your behalf, as opposed to someone you worked with for 2 days who may be a high power individual.
Okay, we're getting lots of questions now. So list. Is it appropriate to wear headphones during the interview?
I think so. I think if that's the best way you're gonna hear, you gotta hear the question, right? So that you can answer it right. Go for it, right? So practice, look in the mirror, how are you gonna put it, look at the Zoom, make sure before you start the video. But I think that it's totally appropriate within the virtual experience.
Brielle, where did you do yours? Did you wear a headset? What was your background? Maybe share with us some of those type of details, if you could, please.
Yeah, so I actually used it as an excuse to buy AirPods. And so that's what I used for my headset, which I think the microphone was pretty good on those. And it wasn't as, cumbersome or annoying looking as big like over and then I sat like in a chair like this, and actually the doors, that right door behind me, I just pulled up my chair to that, so that was my backdrop, so you couldn't see anything around me. A white door, you know, couldn't see the entire room.
Yeah, good.
Didn't see anything else.
Listen, boring is better. I will tell you. It's, you know, I tell people all the time, it's, some people judge and things, but you know, suit, you know, a dark suit, a white shirt, some color and a tie. And, you know, yeah, that's the other thing too, is please dress up for the interviews. Yeah, I'm in a hoodie during this. So anyway, these are informal sessions and things, but always err on the side of being more formal than not, you know, that's, I think, always a good thing. So I think,
Be
go
careful
ahead.
with the backdrops, because if you move, you can disappear, and that doesn't look that great. So be careful, you're gonna use it. Then you practice how much you will move or not. And again, that's a decision, it's a conscious decision. So what are you using in your background, whether it's a photo, or it's your office, or it's your room, it's telling us something about you. So think about it. Use it on your favor.
One thing I would recommend is making sure that wherever you go, you know what your bandwidth is, that you're able to get a good signal to do the Zoom meeting. We do a lot of meetings by Zoom now, and people all over the country, and they sometimes really struggle to get reception. Some of them have headsets on, their microphones are crap. You can't hear anything they're saying. So you need to practice this. Make sure you practice with someone who hear you so that you can be heard on that day. You might need to find a hot spot in your house. Sometimes, you know, like my house has areas that are not so good for reception.
Great.
What
Question.
percentage of rotations are preceptorship model?
I'm sorry, can you repeat? I'm sorry.
Yep. What percentage of rotations are the preceptorship model?
Oh, that's a good question. Well, we can just kind of go through things. The team rotations will be the trauma service, ICU service, kind of the hospital surgical service. Let's see. Team also is thoracic surgery, transplant surgery, and ped surgery. So those are probably the only. We have 6 surgeons in the bariatric, endocrine, metabolic, GI surgery group, breast surgery. We have 6 breast surgeons, Travis, and 4 endocrine.
That's right.
And then 2 MIS, something like
3
that.
MIS, yeah.
Okay, 3 MIS we just hired, that's right. And then HPB, we talked about that. Vascular, there's 7 they need to hire. So that's preceptorship. Thoracics team. What division did I miss? Oh, colon and rectal. Oh my gosh, I don't know how many there are of those now. 10, 12, I don't know. How many, Brielle, how many colorectal surgeons?
I think it's around 10.
Yeah, okay. So that's all preceptorship. So there will be some team, but you know, we are always trying, especially for you all, you know, if you're you know, as first years, trying to get access to the consultant services, you know, you'd be a junior with a senior on the consultant service. So we are always trying to maximize that. So that was kind of the landscape. Travis, do you want to say something?
Yeah, I would say it's at least 50% of the rotations over the course of 5 clinical years. I'll ask Brielle and you know, Sarah to jump in too, but at least 50%. And I'll put a plug in. You guys are aware of this preceptor here too. It is the best way to train by far, because when you're on one service with one consultant, that makes you the surgeon for that service, and you're taking care of those patients from clinic when you see them to intra-op to in-hospital care to post-operative follow-up. And there's no other program that replicates, I think, what we do here.
Yeah, I will go down trying to fight to preserve the preceptorship model as much as I can. We're blessed by a high volume here. And so, you know, we do have fellows, we do have advanced trainees. And so, you know, that you need to ask that for programs as well. They need to be able to tell you how many fellows there are, what are the interactions of the fellows with the residents. And I think we as a group, myself and the APDs have become very well known to be very protective of the residents. They know that we will have any discussion when it comes to quote competition of cases, et cetera, because our default is to preserve the education of the residents, and they know that. Will we say there's never an instance where a fellow is going to get a certain case and the general surgery resident may or may not scrub on that case? The preceptorship model really does protect that. So if you're on an HVB service as the senior, first room. Now, where some of the other staffing is if that surgeon gets a second room and you're kind of on a flex schedule or something like that, where a fellow may go into that second room based on the consultant's discretion. If it's a total pancreatectomy with a liver resectomy, it'd be a fellow case and not a PGY2. But it could be a chief case, could be a 4. And so, there's always active discussion between residents and trainees. But I would say that the preceptorship model, when you can be 6-7 weeks, we do quarters. And so whether it's 6 weeks or 7 weeks in terms of the 13-week quarter, that is, again, you see the patient in clinic, you operate on the patient, you run the service, you're the first call. It's nurses call you. And then if, like Dr. Quay says, load the boat, you're calling the attending. And so it's a pretty special way to train. But there are also team rotations, which again, as a senior resident, I think team rotations are important too, because it does teach you how to function as part of a team, okay? Sometimes when you're on the preceptorship, you may have a couple consultant half quarters in there, and you don't see a lot of your colleagues because you're in your own little world. You'll see people on your rotation, but the team is good. You will develop yourself as a leader. You'll develop yourself how to optimize your team. If you're a 3 on peds, okay, these are my 3 interns. I need to figure out how we can do rounds and get to the cafeteria before, how are we going to stagger the room? Things. There is value in team rotations. I feel. I don't know, Mariella, do you want to talk? You guys run so that the hospital surgical services, Mariella's group, they cover the ICU, they cover trauma, they cover all emergency consults, they cover all in-hospital consults. They also run an elective practice. Is there something I forgot, or have you taken anything else? Anyway. So do you want to speak? You want to speak about the team approach in your area?
Best. Period.
Would you say you think group practice is the best?
There's always a value to everything, and as a surgeon, you will always work in a team, right? Whether no matter what practice you decide within surgery, you will always need to work in the OR with a team. So the skills that you can learn in a group practice will transfer whether you decide to have whatever within surgery or a specialty in surgery. So I think it is extremely valuable, and then also it's going to be good to have that exposure so that you can decide what type of practice appeals to you. There's reasons that I chose this practice, and that again, our reality. So it's good to also have that exposure. But there's definitely both. But we do agree that the Mayo preceptorship is a special thing, and we are here to protect it. And we the trauma critical care general surgeons will always be a group, and we'll always be here for you guys. So.
Well, the other thing too, in Dr. Rivera's group is, forgive. Correct me if I'm wrong, but like there's a trauma consultant on for a week. So if you're the trauma junior or the trauma senior, you may round with the same trauma consultant for a week at a time. And so it almost turns out to almost a preceptorship type thing.
For a short period of time.
Yeah, it's kind of mini little preceptors. So it's not like team A that has 4 surgeons, a chief, 2 4s, a 3, and a bunch of interns. It's not like that. It's, so it's, there is certainly value in both teams and the preceptorship, but okay, well, let's move on to the next question.
Can residents do research other programs, or do they have to do their research at Mayo?
We prefer you do it at Mayo. We have, 2 things. I'll support you. If you have a great opportunity somewhere else, I will support you. We've had people go to other places and, absolutely do wonderfully. The issue with going outside the institution is you need to get your own funding. The clinical investigator program, CI program, we typically get 2 of those awards per year. We just, Mayo as a group, just got a STARR award. It's a NIH funded position. So now we have the opportunity for 3 funded positions per year for really the top residents who want to do research. And so you can get funding if you stay at Mayo, but if you go outside, I will support you. We have someone who he's been over there, it seems like for 4 years now, I believe, getting his PhD. And so, we will support you to go elsewhere, but not monetarily. So that's a Mayo thing. It's not a general surgery program thing. It's a Mayo graduate school thing. So if you get your funding and you're with an outcomes group that publishes 100 papers a year, then yes, of course you have to go there. But we think there's a lot of great opportunities at Mayo too.
Okay, that's on applying to both categorical and rule track.
Yeah, applicants do it. We do the same with, we have the same issue. We have a couple joint programs like joint general surgery and cardiothoracic surgery. We have the rural track. We have the prelim track. So it's not uncommon that people apply to 4 different programs at Mayo or something. We basically look in and determine, what's the best track. If your true desires to be, and you're just applying to both tracks because you really want to be at Mayo, if you're going to end up being on our rank list, we'll rank you on both lists so that you could match into both programs. If you're someone who says that you only want to do the rural track at Mayo Clinic and not regular general surgery, then don't apply to both. So, we look at both and see where you're going to fall. But if you're someone who really want to keep, then we'll rank you on both lists to kind of, enhance our chances of getting you. Teresa, you want to comment on people applying to multiple tracks?
No, I would just echo what you said. I mean, yeah, if you want the rural track, I would apply to that track. Yeah, a lot of people apply to both, so.
Yeah, we end up, if it really comes across that you are passionate about rural surgery and, that's what you want at Mayo Clinic, and you'll probably go elsewhere for rural rather than want to stay at Mayo, then we'll probably just consider you for the rural track because that's expressed to us. But if you say, I just want to be at Mayo Clinic, I'll apply rural, I'll apply general, then we'll rank you accordingly. We don't have a problem with it. Excuse me. We kind of look at where people apply. I will say that you just have to be careful because other programs may have a problem with it. And, there's a lot of sensitivities out there. I don't get it. Sometimes surgeons have sensitive about things. So they may say, oh, well, this person's applying to, plastics and cardiac and general surgery at this institution. Well, their interests, what do they want to do? Are they just trying for fallbacks, et cetera? So it may, brush some sensitivities. I can't guarantee that it won't. So I guess you just have to maybe talk to residents of the program or talk to people, if you're able to insight us, it doesn't matter. That doesn't, I you always want to think the best of people are applying. So I always support maximizing their chances. So just realize that some other programs may look at it and say, oh, they applied to 3 different programs. They may not want to be a hardcore general surgeon, and they may look down on it, which is dumb. But anyway. Angie, did you fall off?
No, I'm here.
Okay.
Okay, what kinds of dates is your program looking for?
Okay, Travis, what's most important to you?
Self-starters, self-learners, people that are aggressive about improving themselves. I think residency is very different than any other phase of education in your life, where, you know, when you're going through college and certainly the first 2 years of medical school, at least, a little bit of it's spoon feeding, right? You're given the syllabus that you have to go through, and there are lectures and such. Residency is more sort of about, you have these wonderful set of cases at the Mayo Clinic, for instance, with all these complex pathologies. And a bit of it is self-education. You know, you have to take it upon yourself to read about those cases, read about your patients, and spend extra time doing that. So what I really start is people that are enthusiastic and will take advantage of what we have to offer here, because the opportunities are endless.
Yeah. Mariella, what's most important?
That you care for you, that's the number one reason, that because you care. That's something that is very difficult to teach. So that's
That's a great point. That comes back into something, maybe a little statement. I've read I've offered on Twitter and some of these. I'm happy to read personal statements, at least give you my thoughts on things. I know I may be a little bit behind if you guys have sent it, but I promise to get it back in a day or two. But the way I think about a personal statement's kind of, it tells a story about you, but don't just tell the story about what you've done. Tell the story about what you've done and how it's made you who you are, and try to bring that back to the patient. And in all of this, after you write a personal statement, circle how many times you use the word I always do that. I go through and I look how many times they use the word I. There's a way to tell a story without using the word I. Okay. And so if you make the personal statement all about you and not about what you want to do or how you want to help others, then it comes across as I've done this, I've done that. There's a way to bring into, you could say, well, during countless hours, with Habitat of Humanity, I came to recognize X, Y, and Z. Well, that's different than saying, I spent this many times at Habitat and we built this many houses, and you're just don't just convey events. We do want to hear the empathic side. I think programs do in general. Megan, what do you think? What's most important to you?
There's a lot.
Yeah.
I think integrity. I think people who are self-reflective. I'm interested in how people handle themselves under pressure. So kind of the resilience, because it's, everyone out that we're looking at on these screens, you've all done amazing accomplishments, but what's far more interesting, I think, is how did you respond when things didn't go well? Because those are the hard times during surgery, when you have complications and you have to be honest, you have to own up to what you did, you have to not think about how bad, but think about your patient. I mean, those are the moments that are going to try you. And so that's what I look for, I think, is honesty, integrity, compassion.
That's great. No, these are great answers. Flo, what's important to you?
Well, I would say, a lot of residents, right, John?
Yeah.
I can't teach honesty.
No.
I can't teach compassion. I can't teach dedication, true grit and dedication. And those qualities that a resident or a surgeon needs. And it always was revealing to me when I had a resident who was really more interested in getting a good grade than they were in taking care of the patient. And you can tell when you talk to them, you can tell when you talk to the patients, they'll tell you.
Oh, yeah.
Not just the patients and me, but the staff in the OR, the secretary. Those are the things that I'm looking for in an individual that we're training.
No, this is great. I would like to, I deferred to my colleague. There are two main things I look for. One, self-initiation, like Travis. There's so many. What's going to come across, as being something special? Self-initiation. So they're going to think what they want to do. They're going to dream dreams. They're going to go after things. This place, Disneyland for the surgeon. Okay, you can do research if you want. It is busier than there's more work than needs to be done, or that can be done. There is teaching opportunities. There's committee opportunities. It's diverse. This can be a platform to achieve anything you want. Okay, it doesn't have its drawback. I mean, it does have its drawbacks, of course. We've kind of talked, but from my standpoint, for the self-motivated individual, the sky's the limit here. That's one. The second one is having insight. And this was, David Farley, who was my program director, a general surgeon here who retired last year. That was his biggest thing, have insight. Learn from mistakes, learn from observing, be able to predict what's going to happen. So, if you show up for rounds, excuse me, if Dr. McKenzie tells you to meet at 8 o'clock and you show up right at 8 o'clock, you think you're right on time and he's sitting there at the computer. Okay, you tell yourself, oh, he must show up a little bit early. And then the next morning you show up right at 8 o'clock, right on time, and he's sitting there at the computer. It needs to dawn on you that, he's telling me 8, but I'm going to show up at 7:45. I tell my residents all the time, if conference starts at 7 o'clock and you show up at 6:57, you think you're 3 minutes early. I say you're 7 minutes late. Okay. I tell everybody to schedule not the time something's supposed to happen, but 10 minutes before. Wake up earlier, plan your time as if conference is starting at 6:50, because people will start seeing who's coming in late. And I can tell you, the consultants are watching, and you want to do the big cases in the OR, then it's little things like that. So when Dr. McKenzie walks up at 7:50 and you're sitting there on the computer, a light bulb will go off in his head. Okay, he noticed I was here 10 minutes early, and this person came 5 minutes early.
Can I just clarify something,
insight.
John?
Oh, you don't come in. I'm sorry, you don't come in before 8 o'clock. Sorry about that. Sorry.
I was going to.
Oh, there you go. Yeah, there you go. I knew that one was coming. Geesh. I was giving you the benefit of the doubt. Geez. So insight, it's learning from observing, it's learning from the past. And that's important for a surgeon. We can celebrate victories, but I don't think if a case goes right, it's supposed to go right. You don't celebrate that. But you need to heed the failures. You need to learn. The most important part of any operation is the debrief. What happened in the operation? And it could have been, there was good communication, everything went well, we had the implants we needed, and it went great. The most important part of every operation is after it's over, is when you debrief and have self-reflection. So that's what I mean about insight. And then Dr. Quay, you can tell probably that I spent probably 48 weeks out of 60 months with her in training. But I err on hiring character. I believe you can teach skills, but you cannot teach character. You can teach the skills, you cannot teach character. That gets back to integrity, gets back to some of those things. So that's my long-winded answer to that. But that was an important one.
I think
Okay,
Dr.
Andy.
Rivera will probably answer this one.
Oh, she just logged. Are you there, Marielle? Okay, there you go.
On preparing for the skills session portion of the interview.
Ooh, I like it. You're getting ready. Section, again, still a work in progress, but we are going to send you a video teaching you how to do it. So don't sweat it. Don't think too much about it. It's skills. It's suturing, and it's suturing skin is might be suturing fascia. Again, we still have some things to do, but we're gonna be assessing some skills. You will send us videos, and the day of the interview, we're gonna be assessing other non-surgical skills as well, like communication. And again, we're gonna send you a very detailed. There's gonna be no surprises. You'll know what you're gonna be going through, and it'll be super fun. I promise. It'll be super fun.
To make it fun, but we're upfront about, you'll get YouTube links. You will be shown the skill to do. Maybe a lot of you can already suture, tie knots, and put felt together and all that. But we will send you the skill we're going to ask you to do. and we have a blackboard, and we can see, who's been practicing, who hasn't. We look at things. There's no surprises. We're totally transparent, but we will be having a task-based as well. That also has to do with some emotional intelligence, some EQ type stuff, communication skills. So again, it's if we think the interview process is stressful, then try peeling a tumor off of the superior enteric vein. That's stressful too. So we need to face very stressful things in our career. So okay, Angie.
Okay. How would you suggest that a prelim student or a prelim applicant discuss that they don't want to go into the categorical, but a different specialty?
That's fine.
Wait, what? So discuss.
I can take that one
How-
on, John.
Okay, go ahead, Travis. I didn't.
I think what they're referring to is they want to go into orthopedic surgery, for instance, but they're going to spend a year preparing our prelim program. Okay, we've had a number of residents that have gone exactly that route. That ecology, ENT, anesthesia, radiology, neurosurgery. That's actually a great start for your career to be successful in that. Yeah. There's no reason to hide that during the interview.
Yeah, we've honestly had people who have applied to plastics, applied to ortho. They didn't match. They're doing it again. They are applying to our program, maybe as a fallback, maybe not. And like I said, these things don't offend us, and our sensitivities aren't brushed by it. It's some programs might, but to us, we want the best talent possible. We want to train the best people possible. And from a prelim program standpoint, I'm very proud of many aspects of the program, but the prelim program here, I think is amazing. The curriculum is basically the same as the categorical. Quite honestly, some of the staff can't tell some of the differences between categoricals and prelims. And so it's not like the prelim is stuck up doing floor work while the categorical is operating. That's not it at all. As a preliminary resident, you'll be the junior on services. Travis, you've had some preliminary residents, I think, right?
Pretty much every rotation, I have only preliminary residents along with the chief resident. And I'll tell you, some of the greatest and most gratifying success stories that I've seen are the ones who are going into these subspecialties and they know it up front. And we match them in these great programs going forward. See that, and they reach their dreams.
Yeah. No, I have a special place in my heart for the international medical graduate, the prelim resident. I mean, the categoricals I'm very proud of, and we get through, to tremendous fellowships and jobs and things. But it like Travis just said, someone who, may view themselves as an underdog, and it's an international medical grad, and they come in and they do well, and then we really work hard to help get them jobs. We write letters for them. We call programs for them. We're not a resident or two each year that has to go into PGY2 prelim spot, but then it's happened 2 or 3 times this year already that programs will have a vacancy, then they'll email us, and then we'll give them the name of that PGY2 resident out there, and we've gotten people jobs that way. And we have a lot of connections around the country too, invariably after match day. And, I'll with you, a lot of the preliminary residents who go through the match again may not. Okay, that's obviously some do, but all hope is not lost if you don't match, because then gamble starts. We get lots of phone calls. Invariably, we get the phone call emails from people we know around the country, and then we start giving out the names. And that's why it's important to come in, hit the ground running, and do the best you can.
Can I make a comment? So for though, I can tell you firsthand that some of the best residents we have in the program today were IMGs that went through our prelim program and then matched in our categorical program because they were so staff we have here at the Mayo Clinic it took exactly the same route. IMGs, they were prelims here, categoricals here or elsewhere, and then hired on staff. So it's possible, and shoot for it, go for it.
Absolutely. That gets back to your own value. Don't view yourself as this helpless person going through the process. So okay, Angie.
Great. Do you put value comments as well, or is that skimmed?
Well, we look at all the contents. It's, we'll be honest with you. We were just discussing this earlier. It's, I predict, and just hearing buzz around, some things on Twitter and some other, med students and things, I think people are going to apply to a greater number of programs this year because of travel. Because of the lack of travel. And I think that's going to put, a little bit more stress or burden. Hi, Coley. Dr. Nelson's child's there. Anyway, what was I talking about? Oh gosh, getting old now. Oh yeah, so too many applications. So we were just discussing our strategy to kind of scan through and really be able to give every application its due diligence. And so we read all the comments. That's the bottom line. The more insight we can get to you all, the better. So.
Does your program recommend sending letters of interest or calling programs to express interest?
Oh, I encourage people to be themselves. So you be you, if that's in your heart to do it, you can do it. Some programs are, dead against it. Some put a ton of value on it. Get some feel from people that whether or not that's important to a program director or not. I think that, if it's important that they hear from you before and after, I'm already getting a lot of emails now, and, and my response is, I'm very thankful, that someone took time to email me. But the biggest thing is to send in your application and kind of, stand by that. And so that's what I would say. I don't know. Teresa, what do you think about that historically?
Historically, so I don't want to discourage anybody from doing it, but programs are so busy reviewing, trying to get through all of the applications that they don't always have time to maybe respond in a timely manner. So I think certainly if you know someone at a certain institution, you could reach out to that person and they can maybe make an introduction to the program that way. That might be helpful.
Yeah, that's what I said. I said, you be you. If there's word on the street, I know there's kind of a big communication network out there and things. If you hear that it's very important to programs, go for it. Don't be discouraged if you don't hear back. I do try when I get those, and just to congratulate, people, and because this is a very exciting time. I totally believe in encouraging people going through the process. So, is it going to impact decision making? I'm not too sure about that. But again, I think if it's in your heart to do it, then don't change something that you would otherwise be doing. Kind of like what Teresa said. But if you have intel on a certain program and it's important and this is a place you want to go, then absolutely go for it. Okay.
Okay. For IMGs for whom it's difficult to get a USCE in 2020, should they attach a recent home country LOR to showcase the current level of knowledge in clinical position, or all old US doctors better?
Perfect. So this gets back to my quality over, and now this is just me. If you did like an externship or an observership or something like that in the States, or even a clerkship, and if you feel that person can write you a great letter, then you need to get them to, as one of your letter writers. If you feel, I truly believe it's important to hear from, and I always counsel people that either are here and meet with me, or I believe it's important to get a letter from your home institution. I think it would just be, a little worrisome if someone had, 3 research letters and someone they did an observership with, okay, and nothing from their home institution. I would like to hear what they were like on clerkships. I would like to hear what they were, how they took care of patients, et cetera. So, being one of the larger, prelim programs in the country, I do counsel people to get at least one letter to have no more than 2 research letters, 2 out of 4. I think the more clinical letters you can get, the better. That's one. But it's okay, you know, if you've done a lot of research and things, that helps with work ethic and things like that. But I think programs are mostly concerned with, you know, how you do clinically, because we're hiring a resident, we're not hiring a researcher. So I would recommend getting something from your medical school. I don't know, Mariella, Travis, Meg, what you guys, in terms of letters, what do you think?
I agree with what you just said.
Yeah.
I think, yeah, quality over, you know, US only. Don't chase the name, don't chase the things. Now, institutions, okay? And I think it's very important that for international medical grads out there, to look at a program's track record. If they've never matched an IMG, they've never had an IMG in their program, and they don't sponsor visas, well, I probably wouldn't apply there. Now, if they have 40% IMGs and they have a big prelim program, et cetera, things like that, oh, apply, please, you know, because not a lot of centers will go out, you know, they view it as going out on a limb. We do not, like Dr. McKenzie said. I mean, some unbelievable people have come through here. And so from my standpoint, a lot of institutions don't have experience with international medical grads. We've gotten to know a lot of the foreign medical schools. We've gotten to know a lot of the, you know, experiences that they come with. And so we just have a different kind of experience and tradition with them. So I would get some from your home institution.
Okay, ready?
Yes.
As an IMG, I'll be applying for a prelim year. What does this year look like compared to the categorical first year? And after completing a prelim year, is there a possibility to go into a PGY 2 year?
Yeah, so I mentioned it. It's the rotations are very similar. The expectations are similar. Everything up and down. You'll be giving talks at the M&M conference. You'll be, you know, required. You're treated exactly the same. That's the bottom line. And expectations for the operating room, clinical responsibilities. Excuse me. Everything is similar. In terms of, you know, we do have a track record of looking at our prelims. Of course, they're right under, you know, in our program, and we're training them. And so we have kept stellar prelim residents before. And some years we haven't, some years we've kept 2. But we evaluate all residents on a myriad. We just went through our clinical competency committee, and there's about 70 discrete pieces of information that we collect on everybody: evaluations, peer-to-peers, how you do in the sim center. Did you get your flu shot? Are you getting parking violations? You know, are you coding your hours? You know, everything from administrative to clinical to evaluation. So, you know, we evaluate all the residents up and down, but if there are stellar prelims, you know, we would, you know, there'd be a chance to stay for sure.
Okay. Does your institute opportunities for residents to develop medical devices during their research?
During the research years, yeah. I mean, listen, if you have an idea, go for it. Mayo has all kinds of mechanisms for innovation, and their name is blanking me. Sarah, do you know the group here that kind of listens to ideas? And then, so you can pitch any idea to Mayo. If they find value in it, they may even invest in it. Of course, they get some cut of royalties or whatever happens. But
right.
What's it called?
And
Mayo Venture.
research.
Yeah, thank you. Mayo Medical Ventures. Yeah. So they have a whole ventures group where if you have an idea, and I can tell you, there's a resident now, he's in thoracic. He has like 20 patents, and he's developing things left and right. He did a PhD, and now he is in the integrated program for thoracic surgeries, a PGY, like, I don't know, 11 now or something. But he has like 20 patents. He's like 100 papers and things. But yeah, again, that gets back to the self-initiation. If you have ideas, that they'll help you develop But now just realize you are a little bit of the, oh, there's Jack too. Okay, Megan Nelson's bringing the whole family.
Family affair.
Well, where's James for crying out loud? Anyway.
Been wrangling him.
Okay. Yeah, so Mayo has all kinds of mechanisms for that. So the answer is yes. You don't even have to be on your research years. If you're in the OR and like you're in some weird position holding a retractor as an intern and your back is hurting, you're like, why don't they just have something that I know people that have taken drawings on paper towels over to Mayo Ventures, then they draw it. They have a sketch person. That is one of the beautiful things of Mayo is they have so many darn resources here. But listen, Mayo's not stupid too. If they think it's a good idea and they think there's some potential to it, again, you're a little bit of, your creative ideas are part property of Mayo and things, but it's, that's just part of the thing. They'll help you get it developed, but then they have they have skin in the game then too. So answer is yes. So you don't even have to be on your research years.
Dr. Stulak, to address that second half, I have friends at Mayo who are very interested in developing their own new products and ideas. And Mayo does own a lot of what you would create if you're their employee. So you just have to be very careful if you want it to be your own product, and you might want to partner with Mayo, but you don't want them to own it from a from that perspective. You have to be very careful that you're not developing those ideas on Mayo property or with Mayo resources such as a Mayo laptop or Mayo computer. Just as a side note, because I had friends in my undergrad and medical school who didn't have the best outcome in that.
That's what I said. You're a little bit of the intellectual property of Mayo Clinic. Now, get to them and they are not interested, then you're fine. Okay, you've gone through, they're not interested, then you can do whatever you want. So from my understanding with me before you go do stuff like that, I guess, then I get to get a cut. So, okay. So what's the next question? I'm joking.
Right.
I'm joking about that. Okay.
How are prelim applicants viewed if they're changing from another specialty?
Like, what do you mean? Like, if they left plastic surgery and now they're applying to general surgery?
Guessing.
Okay. Did whoever send that question, are you willing to clarify? I'd love to answer it.
Yeah, absolutely. So I originally applied for neurosurgery. I am in a prelim position right now, and I within a month I changed my mind and fell in love with general surgery. And so instead of reapplying for neurosurgery, I'm applying for general surgery this cycle.
Yeah, I think that like Travis had said before, we've had people who've applied to ortho. We've I know they're doing research now. They applied to plastics. I think they finished a year in plastics, then left plastic surgery, and now are reapplying for general surgery. So yeah, that's not a problem. We will entertain any of those.
And I just got to say to that, I don't view that as a weakness or a deficit. I view that as a strength. I mean, you've matured, you've gone through some stuff and you've realized what your passion is. To me, that's the type of person we want to seek out, is someone who knows why they want to be here and why they want to do why they want to commit this amount of time to something. Yeah. So good for you.
Yeah, better now than 10 years into a practice where you're not professionally or personally satisfied. So, we honestly try to look at the person, we try to look at the situation, and I think we're kind of fortunate because we have such a big program, and we have, we've just had a wealth of experience over the years, 70 trainees a year. And I don't know how long the program's been going, but 20 years since I've been here. So it's, 1,400 trainees have come through here. So we've seen all the, we've kind of seen all the different progression of people. So to us, that's not a weakness at all. Like I said, some programs may not even entertain the application, I'd be honest with you. So that's their loss, quite honestly. So good.
Okay, I see one more popping up.
Okay.
At personal statements.
I'm sorry, Angie.
Are we still looking at personal statements?
Oh, Angie froze this time, not me. Wow, my internet's been good today. Awesome. Okay, good. Oh, there's Angie. She's back.
Are you still looking at personal statements?
Like from last year, or what do you mean?
You're just, are we reviewing them as part of the application process?
Oh, for sure. Yeah, we actually just talked about that. And I mentioned it earlier. I think this year, the letters of recommendation, the personal statements, some of these other things are going to be a lot more important just because of the really uncertain nature of things. And I think the personal statements very important. So, yep, we'll be developing a grading system for that. And so again, like I said, a lot of our process is not mature right now, but yeah, personal statements I think are ever more in the forefront right now.
I think, was that question more, are you personally reviewing them, John?
Oh, I see. So sorry about that. In my personal, yes, I review, we all share application review. And, I do a good number. I think last year I did 300 or 400 out of the 1,100 or something like that. We all have a very standard way of going through. We all agree on certain things we look for, and we all agree on certain things where we're going to, have a weight. And then we put this all into a big Excel file. And so again, there's multiple pieces of data. It's not just step one. It's not just this. It's not just that. It's everything kind of put together as a composite. And so, from that standpoint, I think we're trying to make it as unbiased a process as possible and, as equitable as a process as possible. So I think do any of the other APDs or Teresa or anybody want to comment on that?
How about I'll ask the next together.
Okay.
How strict are the score cutoffs this year?
Well, we put a score cutoff out there, but I can tell it doesn't stop people from applying. And we were just talking about this. A lot of these are very timely because we were talking about that. I'll review any application that comes in. I can say that if you failed step one and then retook it, unless there's something compelling in the personal statement, and things happen, I get it. But that is probably one of them to overcome. Now, some people have overcome it. Some people have had, terrible tragedies and things. And that's actually the example I used to my team. I mean, God forbid a loved one died, right before, and it didn't go well, but then they came back and then they got a 240 or something. Well, okay, something happened there the first time. So I'm always willing to kind of look at those things. So it's off where I won't look at things if it's under a whatever. So I know the score of 235 is out there, but people still apply without it. And it's more of a soft kind of, that's more of us maybe expressing to you all maybe what the typical applicant has, but that does not mean I can tell you that, and I don't know if they were here back then, but I believe that you do need to pass your boards. That's the bottom line. Is step one the best correlate to us saying that you can take a standardized test? Well, in the past, maybe they thought it was. Clearly, it's going to pass fail, so it's going to be useless for us in a year or so. Then maybe step two will become more important. I have no idea. But we do, as a program, need to get you to pass your board. So we think it does provide some indication, about standardized tests, because all of you will have to take a standardized test for the American Board of Surgery. So that's that's how we look at step one, and we say, okay, what has, what is their performance on exams? Now, can we teach you test strategies? Absolutely. We have all kinds of training courses. We have review sessions. We have a lot of things. I do believe that we can help you with tests for sure. So that's how we view USMLE. So it's not like under this and we're not even going to see, so if we set a cutoff of 235, is a 234 really that 6? One is above our cutoff and one's below. It makes no sense cutoff. It's just kind of this area that's probably where the median of our applicants fall. So I don't know. Teresa, do you want to make a comment? You've seen a lot of years of USMLEs and cutoffs, and what do you think?
Well, the scoring up, people are so much smarter today than they were 23 years ago.
Yeah, thanks, Teresa. I appreciate that. That's great.
No, I totally agree with Dr. Stulak. I mean, we put the cutoff out there, but we clearly that isn't our only criteria. So
Yeah, no, it's one of, again, it's a big Excel sheet and it goes to like letter BB or something. And we have so many different columns and rows. We look at all kinds of data and kind of generate a composite thing. So composite score.
One more in here, and it says, does step 3 matter in the selection process? And do you have a cutoff for that?
Step 3.
Yep, step 3.
Okay, so some schools don't even have their students take step 2 by the time applications come around. So we don't even require, I mean, some schools, some students or applicants just clearly won't even have step 2. So no, step 3 is like what you get right before licensure and things. So step 3 is not required, not at all. No. Oh, I saw one along the same lines. Can you please clarify if you require step 2 CK? Yeah, so that's another thing. It's like schools just don't require students to take it by the time application. So it's really hard for us to put those other applicants at a disadvantage. So I don't use that piece of data. Sure, get a 210, then a 250. Well, something is wrong, is the 2 happen with the 210. So I think that, every PETA that you have, I would send, but we don't require it.
As an IMG, is there any number of years or beyond graduation, which I cannot apply to Mayo?
Question. I guess that, if you're 12, that probably isn't the best. Again, if you're 3 years out, you're 4 years, is there a difference between 3 and 4? It really depends more on what you were doing during that time. Okay. So what if and we've had this, internal medical graduate or international medical graduate, graduated, practiced in an emergency department where they saw 50 patients a day for 3 years. And now they're applying for surgery. That person is an astute physician, and medical school is ancient history at that point. Now, if you've worked for a year and you've been away from the clinical realm for 4 or 5 years, I really do think kind of after year 3 to 4, some of the, it would be, but having said that, again, we look at probably not a cutoff there too, but it depends more on what you're doing during that time. I think, again, if you're a practicing physician in another country and now you're applying for a prelim spot here, oh my gosh, we've had that before, and it's been tremendous. So
For IMG, how will you
okay.
looking at CS versus other pathways of ECFMG certification?
Wait, can you repeat that again? I'm sorry.
For IMGs, how will you be looking at CS versus other pathways of ECFMG certification?
So the clinical skills exam, again, step 2, well, Teresa, do you want to handle that in terms of ECFMG?
well, you have to have passed that to become certified. So I don't know if this is still true, but we used to say as an institution that you should have passed the clinical skills exam by or taken the CS exam by first in order to be ECFMG certified in time to start. I don't, with visas, I'm not sure if that's still true.
Yeah.
I think that's probably still a guideline.
Yeah, if the person who asked that question wants to email me or.
Can I clarify? I'm not the person that asked that question, but I'm an IMG, so I can help everyone. So now, as we don't have CS for anyone, there's 5 different pathways to become ECFMG certificate. So that those pathways are like completely different from one another. And basically, we all have to take a standardized English test so we can qualify our English. And then it depends if you are an old IMG, if you're a recent graduate, or if you're still a student, how you can get the certification. So just for
so that our institution requires it. I think that Mayo Clinic requires that you pass that. I believe.
Well, a change with COVID and things. I
Yeah.
think it's worth, we can clarify, and I've given my email out, or, you can feel free to email. It's just stulac.john@mayo.ed. But so if there's IMGs of that, we can, so much is in flux. We really, with the visas and different COVID things, I mean, sometimes things change with us in terms of our travel, in terms of, with COVID. So if you want big updates, just email me and we can get the information for you.
And as we get closer to the interviews, the rules are changing, so we're really will update when we know when the interviews come in, right? When the applications all come in, and we'll have open communication. Again, many of these rules are not specific for the general student or residency. They're Mayo Clinic or United States rules. So that's why we're not clear, because we don't know where going to be the rules after October 21st. And but we will make sure that we communicate in as a way of reasons or issues related specific to your applications. We will.
Perfect.
Is there any other question, Angie, or
One was another IMG ECFMG. So I'll read it, and you can just, if you want to just qualify what they can email in. It's you interview IMGs if their application for pathway and ECFMG certificate is in process but not completed.
Yes.
Yes.
Yes, the answer to that question is yes.
That was the last one.
Joni, can you copy and paste the information that you did? I'm sorry, kids, it's time to sleep. Yep. So as Joni is retyping, be aware that we are undergoing quality/research project, understanding the webinar. Since this is completely a new thing that multiple programs are doing. So if you would like to participate, it's absolutely voluntary. We would have absolutely no way of knowing who answered what. So if you are and you're willing to share your information, so maybe this is where we are again next year, we can learn from it and make it even better. Please click the survey link in the chat right now, and please give us feedback. We'll make it even better thanks to your information.
Absolutely. Well, this has been fun. This was the 6th. We started in August. I think we're one of the few that have kind of put on multiple ones, like a curriculum type thing. And this has been absolutely fun. It's brought us as APDs together. It's brought us as a program together to really kind of reach out, build relationships. And we're going to have all of these links available. I don't know if many are on Twitter, but the general surgery program has a Twitter handle, and we'll be sending out links. These were all recorded. And so the two sessions ago on diversity and inclusion, and then this one, we'll send out links to all the 4 that we recorded. The 2 resident sessions we didn't record, so that you guys could have badmouthed us if you wanted to, and we didn't record it. But really, this has been a tremendous kind of journey the last 8 weeks or so, and I just wanted to thank everybody. Any final words, Travis or Flo or Mariella or Megan?
Good luck, everybody.
There you go. Okay, good. Well, this was very special. Again, reach out. I gave you my email at the very first session and just told it to you again. And I'm on Twitter. Direct message me if you want. And if there's any questions, we can help answer. So again, thank you for everybody's time.
Yes.
Good
Have a
luck.
night, everybody.
Good luck, everybody.
Right.
Thanks.